past 5 years, probably closer to 7 years, we've been working through this process of finding where is the dollar going. And it really boils down to two things. It goes to middlemen, could be your insurance agent, could be your pharmacy benefit manager, could be the administrator at your hospital system, CEOs making north of $15 million a year at a nonprofit organization. But that has to stop if we're going to realize the Michigan dream. And it's completely possible. It'll take time. It'll take time. It'll take time for us to realize that our benefit plans are not what we think they are. Sure, if you're an employer, you may have 70, 80, 100 plans to choose from. But at the end of the day, they're really only provided by 2 insurance carriers. And if they're priced relatively the same, and we see the same incremental increases that are not so incremental, we're talking 10, 12% medical trend in some years, depending on the pandemic that may have happened in the past or other medical innovations like biologics that somehow justify patent protection and medication that costs north of $5,000, $10,000 per fill. That will meet its end. It's inevitable because it's unaffordable. If it stays the course, only those who are the most wealthy will have the ability to pay for those treatments and services, leaving the rest of the employed hard workers of Michigan holding the bag, incrementally paying out of their paycheck for a health insurance premium that has for the past 10 years only been depleted in actual coverage. Higher deductibles, higher copays, higher coinsurance, higher maximum out-of-pockets, introduction of health savings account as the presumably immediate solution to a problem that if we don't fix the cost of healthcare, we do not fix the rising cost of health insurance premiums provided by employers. But I still remain absolutely encouraged and excited about what we're seeing here in 2024. We're seeing programs like Exponential Health that is providing direct primary care, concierge medicine, and real, true primary care for their participants. Not only at the executive level or at the concierge executive level, but also at the grassroots level, provided by employers. That's what we need. And the most important part is they are independent of a healthcare system, period. I'm encouraged by that. I'm encouraged by programs that allow us to source medications from, if it takes sourcing medications from another country, because our system and the FDA and their approval process and the way that the PBMs, the pharmacy benefit managers, are making money off of your hard-earned dollar, if there's a way for us to source the exact same medication at a third of the cost delivered to our door. Why wouldn't we do that? And what's super encouraging is that we're seeing ways for health plans to sponsor that. Not out of pocket, not out of your hard-earned paycheck, but if you choose that path, you don't pay a dime. Employers who are paying millions, not just thousands, millions of dollars to cover your well-being as an employee now have the opportunity to target one of the biggest challenges, and that's the absolute rampant increase of prescription drugs across the country. I'm encouraged by that. And we build plans. We have employers that are what we're accustomed to spending $13,000 a year back in 2007 to cover an employee's health insurance. Today in 2024, they're paying less than $7,000 because of these tools that we now have at our fingertips. That's exciting to me.